Hospital King Koti. In this video, I will be showing you how to use different inhalers in a correct manner. As we know that main treatment of asthma is proper inhaler use. If you don't use inhaler properly, then your asthma may not be under control. In fact, one of the most common cause of uncontrolled asthma in patients with asthma is improper uses of inhalers. So in this video I will be teaching you how to use different kinds of inhaler in a proper way. Before going to the inhaler technique, I would like to explain you one common myth about inhalers, that there is a habit formation with the inhaler. It is not like that. Inhalers are the treatment therapy which we prescribe because we can give very minimal doses of the medicine to you. Why? What happens is, if the same medicine, if we want to give oral therapy, if we want to give tablets, we need to give 1000 times more dosage. While with inhaler, what happens is the drugs get directly deposited in the lungs. So we can give you very minimal dose. If you can read on the inhalers, the dosage is in micrograms, while the tablets what we usually give, the dosage is in milligrams or grams. So that is one of the most very good benefit of an inhaler therapy. So please don't think that you will have a habit formation with the inhaler or the inhalers are bad. They are the very good therapy for asthma control. See, as you must have seen, there are variety of inhalers available, what we call as dry powder inhaler, metered dose inhaler, breath actuated device, inhaler with the spacer, and then there is nebulization therapy. In this video I will be teaching only about the proper use of different inhalers. So first of all, I will be discussing what is a dry powder inhaler. Dry powder inhaler is a device wherein you will have to, your medicine will be in a capsule form. You will have to crush with device and then take it through your mouth. Suppose you get this kind of inhaler, what we call device for the dry powder inhalation. You will have to open the device like this, put a capsule here, and then close this inhaler, and then press this button twice. After pressing the button, you have to keep this end in your mouth, close your mouth tightly and take deep breath like this. And then you have to hold your breath for 6 seconds and then slowly exhale from the nose. This is the procedure to use a dry powder inhaler. Most important thing is, after using the inhaler, you have to rinse your mouth. Otherwise there may be soreness of your throat. So this is also an important part, that after using any inhalation therapy, maybe nebulization, metered dose inhaler, dry powder inhaler, you have to rinse your mouth. So this is the first kind of device we use for dry powder inhalation. There is another device which is called as revolizer. So this is the device. This is another device where we have to put a capsule which gets crushed in the device and then you have to inhale. So in this device, you have to just open the device, put a capsule here, close it. With this device, with closing only the capsule is crushed. Then you have to put this end in your mouth, close your mouth tightly and then take deep breath. Then hold your breath for 6 seconds and then exhale. So this is how dry powder inhalers are worked. The next is metered dose inhaler. This is the most common inhaler which is used in all the movies. This type of inhaler we must have seen in many movies. So this device you have to, before using this kind of inhaler, what you have to do is you have to shake the device. This is very important. There are two chemicals inside. One is for the proper propellant of the medicine and another is the actual medicine. So with this shaking of the inhaler, this gets mixed. Otherwise only the propellant will come, medicine may not come. So after shaking, you have to slowly exhale. Then put this in your mouth, press it and then inhale. First exhale slowly, put it in the mouth, press like this, and then once you press it, immediately you should start taking the breath. So this is how a metered dose inhaler is used directly. For most of the patient, what we do is we prescribe a spacer. This is what is a spacer. This spacer is, you call it spacer because it creates space between your mouth and the inhaler. Most of the time what happens is, with this direct inhalation, much of the drug is deposited on your tongue and the palate. So what we do is we put this spacer in between. So what you have to do is you have to shake the inhaler, put it in the spacer like this, and the other end of the spacer you put it in the mouth. What you do is you press the inhaler once. Pressing the inhaler, we call it as one puff. So you take one puff like this, all the medicine comes in this. Then you take 6 breaths from inside like this. So these are the 6 small breaths which you take after each puff. With this, what happens is there is no deposition on your tongue or in the throat. Most of the drugs directly go into their lungs. So most of the time we prescribe metered dose inhaler with a spacer. After using this device also, you have to rinse your mouth properly. The next is a breath actuated device. This is the latest device which we have in the company. This device is a breath actuated, means the drug gets deposited after you take inhalation. It is actuated by your inspiration. So you open the device like this, put this in your end in your mouth, close it, and then take deep breath. Once you take deep breath, the device itself propels the drug into your lungs. So this is how the breath actuated device is used, and after taking a deep breath, you will get a sound from inside which makes sure that the drug has gone in. Then you hold your breath for 6 seconds again and then slowly exhale. So these are the different devices which are used in asthma, and as I have shown you, these are the methods or procedures how to use these inhalers. One important thing I would like to mention before ending the talk, that many times what we see is why these inhalers and why can't we take tablets. Again, in the beginning also I told that it is a myth that we get addicted and we get habituated to these inhalers, but it's not like that. See, we should understand that there is a problem in asthma. What happens is the normal windpipe is narrowed. Like we have other diseases like say hypertension. In hypertension, what happens? The blood vessels are narrowed, increasing the pressure in the blood. Same way, in asthma what happens is there is a narrowing of the windpipe. So when the windpipe is narrowed, you need to take medicine to keep it open. It's a kind of disease wherein this windpipe opens up, narrows and opens up in a variable fashion. So sometimes you may feel severe asthma, severe dyspnea, sometimes you may feel less dyspnea. But that doesn't mean the disease is gone. So what we prescribe usually is a maintenance therapy and a reliever therapy. So irrespective of your symptoms, you have to use maintenance therapy. Reliever therapy is a therapy which is to be used in case of emergencies. So suppose I will show you one model to you. Suppose this is your windpipe. This is the normal windpipe, how it looks. In case of asthma, it becomes like this. You see it is so narrow, there is very minimal space for the air to go. When the eject of air goes to this narrowed space, what we hear is a whistle kind of sound. Many of the asthma patients, in case of severe asthma, do hear whistle kind of sound themselves. So when this becomes narrow, you get breathlessness. We don't want this to happen. So we give medicines to keep it open like this. These medicines which is to be taken regularly are called maintenance therapy. So these maintenance therapy are in the form of inhalers and they are to be taken regularly. There is no addiction, there is no habituation. So please keep yourself safe. Use all the inhalers and other medicines prescribed by a doctor regularly. Thank you.